That was a really good question. You know, I'm a woman in my 60s, and I remember back in 1981, I think that was the year when HIV was first recognized. It wasn't even called HIV, and then soon thereafter an antibody test came out. And what I've seen since the early 80s is it seems like every 5 to 10 years people's behaviors change. Sometimes, you know, we think, oh my God, this is a horrible epidemic, and I'm going to live the rest of my life by being 110% protective. But then 5 or 10 years go by, and maybe there's a vaccine that comes out, or a new regimen or treatment, and then we start to see some relaxation, and then maybe not. So I'm not really quite sure how to answer this question, except that I think it's really hard for people to change their behaviors. And I do worry that with medications that are available that can either slow the progress of the disease down or perhaps eliminate it so that cell counts return to their normal state, that signals that some people can then continue or resume a lifestyle from an earlier period where they were more casual about protection and not as cautious in who they were going to be sexually close with. But I'm also recognizing, having worked in the healthcare field for many years, that it's really hard for people to change behavior in such a way that it lasts for the rest of their lives. So I hope that answers the question.